Welcome to Doctors on Call. Now we were curious to see what people do to exercise and stay healthy, and this is what we found.
Wake up early in the morning and try to walk at least 30-35 minutes, brisk walking.
Particular regime नहीं है. It's like I have trainers here. वो मुझे गाइड करते हैं, बताते हैं क्या करना है, and diet plans हैं, nutritionists हैं.
Probably do a little stretching, and then I try to control my diet. I don't eat very fatty food or try to stick to non-oily foods and stuff like that.
I go for jogging, that's my mantra. I go for swimming, that makes me happy. Swimming makes me, relaxed and feel at ease. That's my mantra. I come to gym, it makes me, feel happy about my body. All I do is to, be fit. All I aim is to be fit.
Core हो गया, back हो गया, legs हो गया, almost पूरी body ही है important. तो थोड़ा पूरी body ही करती हूँ.
I don't follow any strict regime to keep myself fit, but whenever I find the time or I have that space, I take a small brisk walk. That's what I do.
Now this was an interesting survey, Sameer. People do all different things to exercise. Some do yoga, some people walk, while others play sports. But I wonder if they're doing it effectively, and are they doing it in a way that will give them maximum benefit?
Now that is exactly what even I was thinking. And I always ask my patients the same thing. Basically, bringing up the question, what is the optimal exercise that actually helps your heart, body and mind stay fit?
Now there are clear guidelines for this. The American Heart Association and also the Indian guidelines both recommend 150 minutes of moderate physical activity or 75 minutes of vigorous physical activity per week. But now, what does all of this mean?
So today, let us tell you what do all these recommendations actually mean. And is the exercise that you're doing enough, too little, or maybe even too much? I'm Dr. Sameer Gupta.
And I am Dr. Sonia Lal Gupta. As we stated, the current recommendations are at least 30 minutes of moderate intensity aerobic activities 5 days a week, or a total of 150 minutes a week, or at least 25 minutes of vigorous aerobic activity at least 3 days a week, or a total of 75 minutes a week, and moderate to high intensity muscle strengthening exercises at least 2 times a week for additional benefits. That includes doing weight training and body weight exercises like push-ups.
Now when you exercise at the right pace, your heart rate increases, your breathing rate increases, and you start sweating. But in most people with low intensity exercise, like say for example walking for 2 or 3 kilometers an hour, would not really cause any of these things to happen. In moderate intensity exercise, you would see an increase in your heart rate and your breathing rate while still being able to talk comfortably. An example of moderately intensive exercise would include walking between 3 to 6 kilometers an hour on firm ground, cycling at less than 16 kilometers an hour, or cleaning your house and maybe even gardening. Vigorous intensity exercise, on the other hand, further increases your rate of breathing, such that you may find it difficult to talk for more than a few sentences without having to stop and take a breath. Vigorous exercises include jogging, walking a kilometer in less than 10 minutes, doing aerobics, or even jumping rope. Now that we understand what are the different types of exercises, one way to know if you're doing your exercise effectively is to use the concept of target heart rate.
Now before you know your target heart rate, you need to know your resting heart rate. Your resting heart rate is the number of times your heart beats per minute while you're at rest, and a good time to check this would be in the morning after having a good night's sleep.
Now one simple way to calculate your heart rate is to place the tips of your second and third finger on the inside of your wrist right under the thumb. You should feel a pulse. Count your pulse for 1 minute to get your resting heart rate. Now on an average, most of the people 10 years and older have a resting heart rate between 60 and 100. A simple way to calculate your maximum heart rate is 220 minus your age. Now an example would be in a 40-year-old. The maximal heart rate is 220 minus 40, which is 180 beats a minute. Now for someone doing moderate intensity exercise, you would want your target heart rate to be between 50 to 69% of your maximum heart rate. While for vigorous exercise, the goal would be between 70 to 85%. So this basically means that the heart rate should be between 90 and 124 beats a minute for effective exercise for someone doing at a moderate pace.
Now this method may not work for everyone, especially if you have diabetes, high blood pressure or suffer from a heart condition. So remember to please consult your doctor before starting any exercise program, especially if you suffer from any medical condition.
Now even if you're healthy, it is important to start slowly and steadily and gradually increase your pace till you reach your goal.
Another thing to remember before we go is that even if you don't have time to exercise, please remember that multiple research studies have shown that some exercise is better than none at all. See you next week.